To High School of East China Normal University. I'm currently in the 11th grade, and it's my pleasure to be here. Thank you.
Good afternoon, judges and audience. I'm Irene from Shanghai World Foreign Language Academy. It's a pleasure to be here. Thank you.
Hey guys, I'm Rachel. I'm from high school affiliated to Renmin University. I'm from Beijing, and this is my partner Lena.
Yeah, I'm Lena from RD at the ICC, like the same school as Rachel. Thanks.
Are you a timekeeper? Yeah. Okay. Do you want to? No.
So, judges ready? Microphones. My time starts now. My partner and I affirm the resolution. H.L.A. Hart, one of the greatest philosophers in the 20th century, stated in 1955 that the government is the corporate scheme that is geared towards the production of benefits for its members. Therefore, if we can prove that there is a need for public health service to expand access to gene editing, and this action provides benefits that outweighs the harms, then we should win this debate. We prove the following definitions. Access is the freedom or ability to make use of something, Merriam-Webster Dictionary. That is to say that as long as the government can utilize the benefit of gene editing in the scope of society, the pro can affirm the resolution. Public health service, according to U.S. Public Health Service 2013, have included food production and consumption for 100 years. Additionally, the law designates food regulations into the public health service. Therefore, food production should be taken into consideration in the realm of public health service. Condition 1 is the status quo. A. Private companies. Dr. Robert Glader, an emergency physician, mentions in 2018 that companies that are researching on and utilizing gene editing technology are being founded, financed, and growing at astonishing rates. B. Limitation of private companies. Private companies have limited scope and provide excludable service, said Sarah Golas and Peter Jacobson, health policy professors at University of Michigan 2006. The private sector may be unwilling to serve the uninsured and underinsured populations who currently receive care from the public health service. C. Global warming. Black Palmer, 2014. In 30 years, the global temperature will rise by 2 Celsius degrees, leading to the drop of crop yield by 12%. But food production will have to rise 60% by 2050 just to keep pace with the unexpected global population increase. And 1 billion people will be in starvation at that time. Therefore, we need to find other solutions to help us feed the giant population. Condition 2, benefits of gene editing technology. According to National Geographic 2018, in agriculture, the technique can create plants that not only produce higher yields, but also ones that are more nutritious and more impervious to drought and pests, traits that may help crops endure more extreme weather patterns predicted in coming years. Gene editing tools achieve the same effects as the previous crop modifying method without transferring new genes from one organism to another. Gene editing is also simpler, cheaper, and faster. Scientists are confident that if this technology can be widely applied to society, possibly being assisted by the government, it can benefit most of the population on Earth in 50 years. Contention 3 is the irreplaceable value of the expansion. A. Public and private sector should work together. By our definition, public health service is applied to the whole population. Thus, public health participation in gene editing is necessary. According to Golas and Jacobson 2006, partnerships between local health departments and private organizations have the potential to sustain or expand public health activities, reduce redundancy and inefficiencies, build relationships within the community, and allow the local health departments to specialize in key functions or expand expertise. B. Innovation. Technology will be developed and improved. So does gene editing technology. People these days shouldn't be afraid of the gene editing process just because of so-called risks. When President J.F. Kennedy set an agenda for the United States to go to the moon, at first many people were nervous about this idea, thought it would cost a lot of money, and there will be many risks. Public health services should be in charge of the innovative projects because they're the ones who are more reliable, more efficient, and more caring for the whole country, the people as a whole. Due to all these contentions above, we strongly urge a pro ballot. Thank you.
Okay, is everyone ready? Time starts now. We negate a resolution. Definition. We believe that a public health service lies under the public sector, thus is part of the welfare system provided by the government. Expand access as to make the technology accessible for the entire general population as a public good. Gene editing technology is modification of existing genes of an organism. Observation 1. In the status quo, we already have expanded access, which is the use of an illicit drug on people with serious or life-threatening condition. Observation 2. As the government represents collective power of taxpayers in making a decision to provide health service on a national scope, its responsibility is to prioritize avoiding risk to taking chances. Framework. The burden of proof lies on the pro side to prove why we need to change the status quo and open gene editing to the entire society, while con shall prove the harms outweigh benefits. Contention 1. Enormous risk. Subpoint 1. Danger. Most research show that gene editing technology is not only unstable, but also causes more mutations than expected and increase the risk of disease. According to the Karolinska study, the dysfunction of the p53 cell, which is used to repair a gene editing tool called CRISPR, will increase the possibility of having ovarian cancers, colorectal cancers by 43%, lung cancers by 38%, and nearly 1/3 of the pancreatic, stomach, and liver cancers. When gene editing technology is carried on to human bodies, it will lead to a massive amount of risk being imposed to the person who are seeking for cure. The more likely is that they are going to gain cancer after genetically edited. It will be extremely irresponsible for the government to expand the dangerous technology to the general population. So point 2, gene editing fails. Alternatives are better. Most people are immune or even could disable a key component of CRISPR. According to CBS News 2018, the researchers who conducted human trials found that 96% of the people in the study had T-cell-based immunity against Cas9, and 85% had antibodies against them. The research by Stanford School of Medicine showed similar outcomes, discovering a 65% antibodies against CRISPR. However, there are better and more effective alternatives. The public doesn't need gene editing. According to the National Institute of Health 2018, targeted therapy, a chemical approach focused on the molecular targets associated with cancer, without changing human genes or germline, now cures 30 cancers, including brain, breast, and lung cancer, with more than 100 approved drugs. Contention 2, ableism. Government's action and decision convey important message to the public. Public promotion of gene editing technology will cause increasing ableist prejudice and exacerbate long-term discrimination against those people who are disabled or marked as inferior. According to Rebecca Cockley, 2017, nearly 1 out of every 5 people in the United States have genetic disabilities. By editing these genes which causes disabilities, the government is sending a message to the public that the disabled are inferior. The authority is suggesting that these symptoms, not necessarily diseases, are undesirable for maximizing the utility of individuals, unfit in society, or ignore the syndrome itself as a personhood of the person. According to Ruha Benjamin, Princeton University, it sees disability as biological failures and reject their genes. It informs people that the assumption of which lives are worth living and which lives are worth editing out of existence. Note that this doesn't have to involve person's own will. What matters is that as a government, the moral and ethical model, it is promoting the technology that is embedded with prejudice. The social message will be propagated and create social separation. It is because of these reasons that we firmly negate. Thank you.
Our time starts now. So now let me ask you the first question. Do you have any solution to global warming?
Why is it our burden to solve global warming?
Because this is the fact that we have to increase the crop yield by 60% by 2050.
However, let me answer the question by asking you. We already have genetically engineered crops. Why do we need to expand access? In a lot of countries, we already have that. That's in the status quo. We're talking about changing the status quo.
Okay, so this technology is still developing in the lab. So this is why the government has to intervene and expand access to this technology. Because we're promoting an egalitarian society, because this technique has already been existing, but we want to let everyone have the opportunity to.
That's all fancy, but judges, we're telling you that in today's society, genetic engineered crops are already being put into market and it's being used. However, it's not topical of today's debate because we're debating something even important. We're telling you that these genetic engineering tools are actually killing people, causing
Yes,
cancer.
and so does global warming. It's killing 1 billion people by 2050,
However,
and you provide no solution
I
to
do not
global
believe
warming.
that solving global warming is the topic of today's debate, and it's not our
It's
burden
definitely
to provide.
related to the topic of gene editing
not-
because we're using this technology.
It's not our burden to prove that we can solve global warming, and
Then what is your burden to prove?
we can only, as we said, as a government, making a decision on a national scope. There is responsibility to make sure we're not taking risks, we're not taking chances.
Of course we're not taking
people's
risks.
lives.
And we're using gene technology in order to save 1 billion people's lives. So I don't see the point you're making.
How is gene technology already saving 1 billion people's lives?
It is going to save 1 billion people's lives because of governments expanding access to this technology.
We already showed you that in the current status of development, we see that these gene-edited technologies, instead of helping people, it causes cancer and it has off-target effects and all these mutations because genes are extremely complex. You cannot edit one gene and expect it to not change.
That is also why the government has to expand access to this technology because it has potential risk when it's applied on people. So that is why we need government intervention and regulations.
Expanding access doesn't mean that merely putting more funds into research.
It's
and
not
saying-
necessarily
and
putting
saying
more funds.
Someday we'll reach some benefits. However, we're talking about right now, should we apply this drug to the general public? And that answer is clearly no, because gene editing is extremely dangerous.
Okay, so because it has some potential risk, and that is why the government needs regulations in this technology, right?
It's not some potential risk. It causes cancer instead
So-
of curing it.
So you're saying that we definitely need government regulations. And that is why we have to expand access to this
How
technology.
is government regulation?
Government regulation is part of this.
Take 30 seconds for that. So chapter 30, opponents, partner. So Mariboto's speech starts now. We're the pro team and we affirm the resolution. First, moving to our opponent's first contention about CRISPR is dangerous and the failure of the gene editing. First, CRISPR is safe. The article of CRISPR will cause hundreds of unintended mutations. False, and CRISPR is actually safe. An article published in Nature magazine in May 2017 raised serious concerns about CRISPR-Cas9, as I mentioned. But the scientists who wrote the article reported that using CRISPR-Cas9 to add the genes could cause hundreds of unintended mutations. That wasn't the end of the story, though. In March 2018, the original article was rejected, and an error correction was posted to a scientific website. The initial research was flawed. Instead of CRISPR-Cas9 producing hundreds of unintended mutations, the scientists stated that the gene editing approach can precisely add to the genome at the organism level and may not introduce numerous unintended off-target mutations. And secondly, nature reproduction, as they're said about the alternative, is even more dangerous and diseases are causing. According to John Harris, professor emeritus in science ethics, those who fear the risk of gene editing don't take into account that the inherent dangers in the natural way we reproduce. 2/3 of human embryos fail to develop successfully, and most of them within the first months of pregnancy. And every year, 7.9 million children, 6% of total births worldwide, are born with a serious defect of genetic or partially genetic origin. And also, the solution in current public health isn't safe as well. And thirdly, safety issue doesn't have impact in our case because we are given more access for the company to promote innovation and to improve the technologies, which has a link to our last contention. It doesn't mean the FDA will pass the treating methods with no requirements, and the methods will still have to be safe. in order to get passed by the FDA. And on this point, return their point by saying that the public health will set more regulations to keep this technology safe. And also talking about discrimination and ableism, they say adding away certain type of genes lead to discrimination, and there will be discrimination between people that have access to gene editing and people that don't have the access. However, the only thing we are mentioning in our case is about expanding access to provide more benefits to the people. So our opponents should prove that why giving more access for researchers on treatment and solving diseases will cause discrimination. And my second response is that the most important response, even if their logic also applies to the cases of diseases, turn their case because Dean Berger, economist and the co-director of the Center for Economic and Policy Research, said that if we didn't give access to more companies, the companies that have access will monopolize the market and will have rights to lift the prices, which means that in Kong's world, only the rich people have the right to do gene editing, and only the rich people have the right to change their disabilities, which will increase the inequality problem and increase the discrimination even harder. And then going back to our case, our opponents failed to show the harm of the expansion. They only talk about the harm of the technology. They tell you that our technology isn't safe. But the thing is, what we are debating about is whether we should expand this technology to the public. And in our case, we already show you the status quo is that people are trying to have this technology, and we are doing gene editing one day anyway. So why don't we expand and get as much benefits as we can? And it's our opponent's burden to prove that the harm of the expansion, because we tell you that both the public and private sector should work together. According to Sarah Godas, partnerships between local health departments and private organizations have the potential to sustain or expand public health activities. 59 reduce redundancies and inefficiencies. 65 build relationships within the community, and 67 allow the local health departments to specialize on key functions or expand expertise. And also, the private sector sometimes fails to respond to disease outbreaks, which is even a more serious condition, because sometimes the private sector fails to respond to get more resources as they can. And if they lack government's regulation, government support, there may cause even some more serious impacts. Thus, we affirm. Thank you.
20 seconds to have time. Thank you.
Okay, judges ready? Opponents ready? My rebuttal will start now. Judge, first, I have to clarify that today we already have expanded access. Thus, the burden lies on the pro side shoulder to prove why must the change and reform of the public services into having a gene editing technology. Okay, so first about topicality. Should word in the resolution indicates that pro side has the burden to prove that expanding access is feasible. The pro side is saying that expanded access is not mutually exclusive with all of the other public health services, when the fund is limited. If the pro side is not cutting all the other welfare programs, they have to prove where the extra fund is coming from, or else they cannot achieve all of the benefits they claim because there's not enough fund. So we'll go over their contentions one by one, right? So their first contention is about food. So currently, we already have the gene-edited crops and the gene modification crops. So how are you going to expand the access when the access has already been expanded, right? We can now buy gene-edited crops in the supermarkets. So how are we going to expand the access? They never explain that link. Second of all, is that global warming is more connected with industrialization, right? Where carbon dioxide is produced by the industry. The pros I never tell you why growing more crops and growing more gene-edited crops can actually solve global warming, right? They never tell you why this can reduce the carbon dioxide emission, right? They never show the links. How exactly is gene editing technology going to reduce the problem, right? So for their problem about gene editing technology providing more food, we have two answers for that. First, gene editing technology decreases biodiversity. Gene editing technologies, when applied to crops, decrease the biodiversity of the species, as some local of the genes are edited into the same to better cope with the environment, right? These kind of genes can be inherited by its offspring. This will create genetic pollution, which has already been happening in the genetic modification programs, right? This could cause a single virus, which attack these edited genes, causing the extinction of the crops. Naturally, these events would not happen as the gene of the virus are variant, and virus and bacteria usually relies on one specific protein translated from the specific genes. So said Charlie Beckley, once they're released, they're permanently into the environment and cannot be recalled. Therefore, when the long-term effects remain unknown, we believe that we should expand the access after we know this technology, when this kind of technology is mature enough. Second is that the long-term effect remains unknown. So the European Call Law just ruled out the regulations for gene-edited crops, right? They tell you that public opinion for gene-edited crops is still remain a no, because the gene-edited crops just come out within the recent years, right? So the long-term effect for human beings to eat it remains unknown. So therefore, we believe the government, as the investors of the collective power of taxpayers, they should do it on taking the opportunity cost also. So their second condition is basically about how the public sectors can allocate their resources better than privatized sector, right? We're going to tell you that the private sector actually lies under the government regulation. So all they talk about how private sector actually has no regulations wrong. And second of all, we are going to tell you that private sector is actually working better in the circumstances. That the private sector is more efficient. Alternative solutions achieving the same effect. And the public health service is actually in a poor function. So the public health service is in poor infrastructure. So the government corruption report 2016 shows that the Transparency International documents corruption on a vast scale in both rich and poor countries, and its enormous cost to public health. It is estimated that at least $3.1 trillion are wasted in public health services each year. So by indicating this, we show you that when money are invested into the public sector about gene editing technology, majority of the money will go into rich people's pocket. And second of all, Nigeria's National Agency for Food and Drug Administration shows that 68% of the drugs in the country are unregistered and therefore probably counterfeited or substandard. Therefore, we're showing that the public sector is actually failing to provide these kind of technology safe and sound. Second of all, is privatization actually encourages innovation and reduces government costs. According to Harvard University, the privatization can actually reduce the government costs up to 30 to 50%, which means the government is only going to cost less while applying these kind of technology, while applying the expanded access into the private sector. And second of all, we tell you that actually it could create innovations in the long term. So on their side of the house, this problem is never addressed. Thank you.
Ready? Time starts now. Can I get the first question?
Of course.
So why do you say keeping it private can have innovation in the long term?
Well, first of all, we know that private sector actually now have innovation investment, and therefore, because the profit that privatization sector can gain from innovation, these companies are more likely to get more innovation, and majority of the innovation are not developed from the private sector. My turn to ask a question.
Sure.
Can you specify the link between gene-edited crops and reduction in carbon dioxide emission?
Okay, so first, gene edited food have two different advantages. The first one is it can have more nutritious food. So within the same amount of the land, it can provide more and more food. The production rates is higher, which means that we will...
Oh, okay, just have a quickly follow up.
Yeah, sure.
So currently, we already have the gene modification food, which can achieve the same effect.
Yes, and that's definitely the point where we should expand access.
So the access has already been expanded. What extra access do you want to expand in this kind of field?
If public health expand access to this kind of technology, which means that all of the public companies can get this technology to added food.
Well, first
so
of all,
more
all
people
of the
will
public
get benefit from this
so all
technology.
of the public firms and the private firms currently they already have the accessibility to add these kind of food. So why do you need to expand it more?
No, as we said in our condition, we tell you that because they really need government support, because giving a food and productive food to the public needs the government's permission and need FDA approvals as well.
Okay,
And
so
all those things are included in public sector.
Okay, so just have a quick follow. You still doesn't explain why this is related to global warming, which is one very important point in your whole contention.
My partner will explain this link in her summary.
Okay, then I'm going to ask you about discrimination. Sure. Do you believe that actually we are excluding some sources, ethical groups because they are believed to be inferior in this case?
Not really. And how does it really link to the point you don't really need the suspension?
Well, first of all, we tell you that within the expanded access, these people can actually enjoy the benefits. And second of all, the government is making a law to protect
Sorry,
them.
can I ask a follow-up? But then to realize if you don't expand access, a certain group of people cannot really get this technology.
But what if
they have a chance to experience?
What if these people don't want it? What if these people?
How do you know?
What if these kind of people don't embrace the personhood as? They embrace their symptoms as their personhood. They form a certain culture and
okay, so
communication.
you mean that some people with disabilities they just don't want to solve it?
Well,
they just want to keep it like
some
that?
of the disabled people, they want to be treated as normal people while imposing gene editing technology onto themselves. You're telling them that they're genetically inferior than the others.
No, so are you saying that blind people don't want to see the world?
Well, we're telling you that when blind people have been born onto the world, we should not put the
So we should not save him when we have a way to save him.
Well, first of all of the benefits you have claimed, you have to do germline editing, right? You have to edit the gene before they are born, right? How can the parents choose for the child? How can people choose it for the child, what kind of people
We
they want.
we didn't say that we're gonna design baby. We don't let the parents.
But if you
choose
don't design a
themselves.
baby, how can you make a blind person suddenly see something?
Thank you.
30 seconds. 30 seconds. Microphone's ready? Judges, my time starts now. I'm going to summarize the previous debate. Common argues that food production is not topical in this debate. The Public Health Service has included food production and consumption for 100 years. Additionally, the law designates food regulation into the Public Health Service. Therefore, food production should be taken into consideration in the realm of Public Health Service. Kant says that gene-edited food has already appeared in the market, but it does not mean that the scope of consumers is increasing. Less than 1% of the global population have access to gene-edited food, mainly because of the rocket high price. When government expands access to these technology, price control and other regulation techniques will benefit the population. We, the Pro team, argues that biotech companies are growing at astonishing rates, but have limited scope and provide excludable service that only benefit part of the population. Pro urges the Public Health Service to expand access in order to benefit the society as a whole. And when private and public sectors work together, they can reduce redundancies and inefficiencies. ProSite has no burden to prove how gene-edited food will solve global warming, but rather we're saying that gene-editing food technology will save 1 billion people's lives, which are threatened by global warming. In 30 years, the global temperature will rise by 2 Celsius degrees, leading to drop of crop yield by 12%. But food production will have to rise 60% by 2050 just to keep pace with expected global population increase. And 1 billion people will be in starvation at that time. That is why we need to find other solutions to save 1 billion people's lives. Gene editing increases crop yields and is also simpler, cheaper, and faster. Scientists are confident that if this technology can be widely applied to the society, possibly being insisted by the government, it can benefit most of the population on Earth very soon. Therefore, it is clear that expanding access to gene editing technologies bring more benefits than harms that the Kant team claimed. Thus, we urge you a pro ballot. Thank you.
20 seconds from. Is everyone ready?
Yes.
Okay, time starts now. I would first like to exclude their arguments about firstly expanded access. We already have expanded access in the status quo. As the topic suggests that we are going to expand access, so their contention about food should also go away because we already have these genetic edited crops in the markets. Okay, so this debate suggests that public health system should expand access, right? So the action taker here is the government. So we need to talk about the government's obligation. When a government is making a decision for billions of people on the national scope, its first priority is to prevent risk. Here, the obligation is not to gamble for some potential benefit, it's to prevent risk. And we have already told you that gene editing is highly risky. Firstly, we introduced the idea of genotoxicity. According to Blood magazine, gene editing in healthy stem cells, 1 to 3 mutations are occurring per cell division. And secondly, we tell you by common knowledge, every time when a gene combines, it produces mutations and when you use gene editing technology, it produces off-target effects. And secondly, we have the evidence showing you that actually in these trials, we see that gene editing tools actually increase the likelihood of cancer by as much as that 43% in human bodies. So it's proof that gene technology is extremely dangerous and the government should not risk it and apply to the general public. Secondly, about ethics. The government being the ethical model, now offering gene editing technology to to rule out these disabilities is telling the public that the disabled people are unfit. They're unfit for the society. They're inferior. We've been talking about disabled people for ourselves, but what about what they have to say? Rebecca Coakley is a White House worker who has dwarfism and spent her life advocating for dwarfism culture. They said that this is their own culture, it's their own personhood, and you should